Hello, everyone. Megan Smith, Chief of Innovation Impact at NDBN, and pleased to provide the report to the board on the Department of Innovation and Impact happenings since we last spoke and last met. Um, Thrilled that we have officially launched, as of last week, the first ever dashboard on diaper insecurity in the US. And here is a screenshot from that dashboard, also providing the URL which you can access, and you can use the dashboard on your own time. You can look at your state, you can look at your county, but just a review that over the last year, NDBN collaborated with the Urban Institute to develop this first ever data visualization tool and dashboard on diaper insecurity. And the dashboard is utilizing National Diaper Bank Network data from our annual member survey, along with existing data sets on health and maternal and child health and community wealth, debt, to conduct this analysis. And based on the information in the dashboard and the NDBN data, we worked with the Urban Institute to put out a brief that accompanied the launch of the dashboard, where we found that it would take an average of almost 4.8 billion diapers each year to fill the diaper insecurity gap in the United States. And really the purpose of the dashboard is to highlight that the understanding of this gap can really help federal and state and local policymakers, as well as advocates and community leaders, to develop strategies to improve access to basic material needs and ultimately ensure what families have to make them healthy and thrive. We think that a key part of this dashboard, as is a key part of all of the work done in innovation and impact, is to really make data accessible to policymakers so that we're translating our data and our research into policy and advocacy. Also really intentional with this dashboard, not in any way to suggest that our members and basic needs banks are not doing their job, but really to highlight the additional partnership we need from the federal and the state government sectors, and of course philanthropy, to help continue to meet and address diaper insecurity in the US. But this was a major piece of what we've been working on in the last year with Urban, as many of you know. And when you go on the dashboard, you can highlight, again, your states and your counties, and it will tell you exactly the diaper gap in your county and state. We did find through this analysis that about 50% of the counties are served by a basic needs bank in the US. And of course, we're working strategically with member services to be able to grow members and bring on any new members in a very intentional way. And Amy will, of course, update you on that piece. The launch of the dashboard was done as part of a bipartisan congressional briefing that Lacey spearheaded, and I know you'll hear more about. But we were thrilled to have 4 members of Congress help us to introduce the dashboard and really speak to the importance of data, lifting up data for them, for their colleagues, and really to make the data accessible and usable in a format that their constituents and members in their states can be utilized as well. Additionally, another great example where Dr. Kelly Massengale, our Director of Research and Statistics, has been working with our annual diaper check data to lift up data for policymakers has been in the area of TANF, Temporary Assistance for Needy Families, or welfare. And this infographic has been really helpful in talking to policymakers who are interested in introducing policies around TANF in this current climate. Interestingly, TANF has not been as decimated as I would say SNAP has been in the current round of cuts at the federal level. So there is some potential for working with the TANF system, and in some states that is already being done. But we're finding that about 54% of TANF recipients are reporting that they're missing work because they don't have enough diapers. And the key goal of the TANF program is, of course, to get people back to work. And so with diapers being a huge barrier to that, we want to highlight that, and we want to really think creatively and constructively with policymakers about how to develop better TANF policies to address diaper insecurity. Additionally, so Dr. Massengale has presented these findings at research conferences, and we do have a manuscript that she is working on to put under review. In addition to the presentation on TANF data at the National Association for Welfare Research and Statistics, we've also had 2 presentations accepted at the American Public Health Association. One looking at the data that we did from a national survey around public support of placing period products and period supplies in bathrooms in schools and universities. And this really helps to highlight that there is public support around period supplies. The other abstract was around the parental report of diaper insecurity and really thinking about opportunities for the healthcare sector to address diaper insecurity. This is also coming at a great time when there have been 2 recent publications around pediatric screenings for diaper insecurity in the New England Journal and in the journal Pediatrics. Additionally, Kelly spearheaded a proposal to the REX conference, which is the large research conference that the U.S. Department of Health and Human Services through the Agency for Children and Families puts on. And that is really a proposal with several other partners to highlight both diaper insecurity, but also the data dashboard and potential partnerships with states, governments to address diaper insecurity. So these are some of the premier research conferences that we want to be featuring our work in now, and we're really excited that we've had such luck already and track record with having our abstracts accepted. So this continues to be part of the strategic goals for the department, is to ensure that our research findings are being presented at conferences, and also really in line with our last strategic plan to make sure that we are also formulating partnerships at the federal level, which quite honestly in the current environment has proved challenging, but I think we are seeing traction, again, bipartisan traction in the areas of supports for families. So we'll continue to take advantage of the openings we have there in partnership with Lacey and Troy and their departments. Additionally, as part of our work to continue our academic partnerships and scholarships, we continue to publish in peer-reviewed journals. Reminder that Kelly and I are editing the first ever peer-reviewed journal series on basic material needs and women's health across the life course. I also recently co-authored a chapter for Georgetown University Press, really around how basic material needs and early wealth building opportunities like baby bonds can impact maternal, infant, child health, and adult health, along with Kelly and Kels Bowman, who is receiving her PhD from Duke School of Public Policy and interned with National Diaper Bank Network. We've authored an entry into the Encyclopedia of Menstruation about period product insecurity. And then Kels has used her analysis from Diaper Check to put together a manuscript that is under review at the journal, at the Women's Health Journal. Additionally, in our partnerships with states, we continue to explore our super bundle, which is partnering around maternal mental health, the Moms Partnership Model, which is being replicated in states, baby bonds, which are being piloted in 9 states right now, and then incorporation of diapers and basic material needs into this model. So really the understanding that to be on the cutting edge of our work, we need to be ensuring that we're incorporating discussions of basic material needs into these larger conversations about economic opportunity for families and these pilots around baby bonds and wealth building. And we are in the process of developing a memorandum of understanding with the state of Vermont to do this work in the state. It'll be the first state that we are testing the super bundle. That is a partnership with Urban Institute, the New School, the Moms Partnership through the Ill Child Study Center, with NDBN in the lead. And we are highlighting that this is a really unique partnership that we can replicate with other states with our Office of the Treasurers. We have Treasurer Mike, who's the treasurer in Vermont, being a fantastic spokesperson for our work and our partnership. And as part of this, have been working closely with Tamara and her department, with Molly, around the corporate partnership sector to really also, again, keep us at the cutting edge of the work going on right now around these ideas of newborn supply kits or bundled basic material needs for families. And so having our own NDBN mama and baby bundle, we've established really the core components of that bundle being diapers, postpartum pads, period supplies, hand soap, laundry detergent, dish soap, and the wipes for diapers, that we believe these are foundational components of the bundle. So working with Molly to develop corporate partnerships that could potentially sponsor components of this in the bundle. Also with our partner at the March of Dimes to look for corporate funding to launch a pilot of this mama and baby bundle and be able to evaluate it. And also we did submit a proposal to the Tennessee Medicaid TennCare to evaluate the first ever diaper benefit through Medicaid in the country. Excited with Dr. Mays joining the board of the potential, given her connections to Tennessee, to think about doing that evaluation with Department of Innovation Impact and the Yale Child Study Center potentially together for Tennessee. So look forward to seeing all of you in October, and you will see much more about the dashboard there. And I know Troy is providing an update on the frameworks work we've been doing. So thanks so much, and look forward to seeing you soon. A big thanks to all of the Department of Innovation and Impact, Dr. Kelly Massengale and Malaysia Williams, for all of their work making the I&I work possible. Looking forward to it.